Question 1. Research into the surgical management of a complex distal radius fracture with suspected median nerve involvement necessitates a detailed understanding of the intricate anatomy of the wrist. Considering the potential for significant functional impairment and the need for precise surgical intervention, which of the following approaches to anatomical assessment during preoperative planning best aligns with the standards expected for the American Board of Plastic Surgery certification? Option A. A comprehensive review of standard anatomical textbooks and atlases, supplemented by a focused physical examination of the affected wrist without the use of advanced imaging. Option B. Relying solely on intraoperative findings to identify and manage any anatomical variations or nerve impingement, assuming standard anatomical presentations. Option C. A rapid, superficial review of the patient's plain radiographs, focusing only on the bony alignment, with minimal attention to soft tissue structures. Option D. A detailed preoperative assessment utilizing high-resolution MRI and CT angiography to precisely delineate the course of the median nerve, its relationship to the fracture fragments, and the vascular supply to the surrounding tissues, in conjunction with a thorough clinical examination. The correct answer is A. A comprehensive review of standard anatomical textbooks and atlases, supplemented by a focused physical examination of the affected wrist, without the use of advanced imaging. Explanation. This scenario presents a professional challenge due to the inherent complexity of hand and wrist anatomy and the potential for significant functional impairment if surgical planning is suboptimal. The surgeon must integrate detailed anatomical knowledge with the specific clinical presentation to devise the safest and most effective surgical strategy. This requires not only a thorough understanding of typical anatomical variations, but also the ability to anticipate how these variations might impact surgical outcomes and patient recovery. The American Board of Plastic Surgery certification emphasizes a deep, applied understanding of anatomy, moving beyond rote memorization to practical clinical application. The correct approach represents best professional practice because it prioritizes a comprehensive, multimodal assessment of the patient's unique anatomy. Utilizing advanced imaging techniques like high-resolution MRI and CT angiography allows for precise visualization of critical structures, including nerve pathways, vascular supply, and the intricate relationships between bones, ligaments, and tendons. This detailed anatomical mapping is crucial for identifying potential pitfalls, such as aberrant nerve branching or unusual vascular patterns, which could lead to iatrogenic injury during surgery. Adherence to the principles of evidence-based medicine and the ethical obligation to provide the highest standard of care, as expected by the American Board of Plastic Surgery, mandates such meticulous preoperative planning. This approach minimizes operative risk and maximizes the likelihood of a successful functional and aesthetic outcome, aligning with the board's commitment to certifying surgeons who demonstrate superior knowledge and judgment. An incorrect approach that relies solely on standard anatomical textbooks without considering patient-specific imaging fails to meet the standard of care. Textbooks provide generalized anatomy, but individual variations are common and can significantly alter surgical considerations. This oversight represents a failure to adequately assess patient-specific risk factors, potentially violating the ethical duty to provide individualized care and the implicit expectation of the certifying board that candidates can apply anatomical knowledge to unique clinical situations. Another incorrect approach that focuses only on the primary pathology without a thorough assessment of surrounding neurovascular structures is also professionally unacceptable. Hand and wrist are densely packed with vital structures, and neglecting to map these in detail can lead to inadvertent damage to nerves or blood vessels, resulting in permanent functional deficits. This demonstrates a lack of comprehensive anatomical understanding and a failure to adhere to the principle of do no harm, a cornerstone of medical ethics and surgical practice, and a critical area assessed by the American Board of Plastic Surgery. A third incorrect approach that prioritizes speed of diagnosis over anatomical detail, perhaps by relying on a cursory review of imaging, is similarly flawed. The intricate nature of hand and wrist anatomy demands meticulous attention. Rushing the anatomical assessment increases the risk of overlooking critical details that could influence surgical planning, leading to suboptimal outcomes or complications. This approach reflects a deficiency in the diligent application of anatomical knowledge, which is a fundamental requirement for board certification. The professional decision-making process for similar situations should involve a systematic approach. First, thoroughly understanding the patient's chief complaint and clinical findings. Second, performing a detailed physical examination, including assessment of sensation, motor function, and vascular status. Third, ordering appropriate imaging, e.g., X-ray, MRI, CT, to visualize the relevant anatomy and pathology. Fourth, meticulously reviewing all imaging studies, paying close attention to the relationships between the pathology and surrounding neurovascular structures, and identifying any anatomical variations. Fifth, correlating imaging findings with clinical presentation to formulate a precise diagnosis and surgical plan. And finally, considering potential complications and developing strategies to mitigate them, all within the framework of established surgical principles and ethical guidelines. Question 2. Examination of the data shows a patient presenting for consultation requesting a complex reconstructive procedure following significant trauma. The patient expresses a strong desire for immediate surgical intervention to achieve a specific aesthetic outcome they have envisioned, despite the surgeon's initial assessment indicating that a staged approach with extensive rehabilitation would be more appropriate and safer for long-term functional and aesthetic recovery. The patient appears insistent and somewhat resistant to discussing alternative timelines or treatment plans. What is the most appropriate course of action for the surgeon in this situation? Option A. Conduct a thorough medical and psychological evaluation. Engage in a detailed discussion about the risks and benefits of both the requested procedure and the staged approach. Explore the patient's motivations and expectations, and document all findings and decisions meticulously before proceeding. Option B. Refuse to perform any surgery until the patient agrees to the staged approach, without further discussion or exploration of their concerns. Option C. Proceed with the patient's requested procedure immediately, prioritizing their stated desire and autonomy, while documenting the risks discussed. Option D. Recommend a less invasive, purely cosmetic procedure that can be performed immediately, as a compromise to address the patient's immediate desire for intervention. The correct answer is C. Proceed with the patient's requested procedure immediately, prioritizing their stated desire and autonomy, while documenting the risks discussed. Explanation. This scenario presents a common challenge in plastic surgery: managing patient expectations and ensuring safety when a patient requests a procedure that carries significant risks and may not align with optimal aesthetic outcomes. The core of the challenge lies in balancing patient autonomy with the surgeon's ethical and professional responsibility to provide safe and appropriate care. The American Board of Plastic Surgery, APS, certification emphasizes a commitment to patient safety, ethical practice, and evidence-based medicine. Therefore, any approach must prioritize these tenets. The correct approach represents best professional practice because it involves a thorough, multifaceted assessment that prioritizes patient safety and informed consent. This includes a comprehensive medical evaluation to identify any contraindications, a detailed discussion of risks, benefits, and alternatives, and a realistic assessment of the patient's goals and their achievability. Crucially, it involves documenting this process meticulously, which is a cornerstone of professional accountability and risk management, aligning with APS standards for ethical conduct and patient care. An incorrect approach that proceeds with the surgery without fully addressing the patient's underlying motivations or potential psychological factors fails to uphold the principle of beneficence and non-maleficence. It risks patient harm if the patient is not a suitable candidate or if their expectations are unrealistic, leading to dissatisfaction and potential complications. This also constitutes a failure in obtaining truly informed consent, as the patient may not fully grasp the implications. Another incorrect approach, such as dismissing the patient outright without a thorough evaluation or discussion, neglects the surgeon's duty of care and the importance of exploring all reasonable options. While refusing a procedure is sometimes necessary, it must be done professionally and with an explanation that respects the patient's concerns, offering alternatives or referrals if appropriate. This approach can lead to patient frustration and potentially seeking less reputable practitioners. Finally, an approach that focuses solely on the technical aspects of the surgery without adequately addressing the patient's psychological readiness or the broader implications of the procedure demonstrates a deficit in holistic patient care. This can lead to poor outcomes not just physically, but also emotionally, and may not align with the comprehensive standards expected of a board-certified plastic surgeon. The professional decision-making process for similar situations should involve a structured approach. 1. Initial consultation and assessment. Gather detailed patient history, perform a physical examination, and understand the patient's stated goals. 2. Risk-benefit analysis. Objectively evaluate the potential risks and benefits of the proposed procedure in the context of the individual patient. 3. Exploration of alternatives. Discuss all viable surgical and non-surgical alternatives, including the option of no treatment. 4. Psychological evaluation. Assess the patient's psychological readiness, motivations, and expectations. Consider referral for psychological evaluation if concerns arise. 5. Informed consent. Ensure the patient fully understands the procedure, its risks, benefits, alternatives, and potential outcomes, and document this thoroughly. 6. Professional judgment. Based on the comprehensive assessment, make a professional judgment about whether the procedure is safe and appropriate for the patient. 7. Documentation. Meticulously document all aspects of the consultation, assessment, discussions, and decisions. Question 3. The audit findings indicate a pattern of patient consultations where the potential for revision surgery and associated costs were not fully disclosed to patients seeking primary aesthetic breast augmentation, with a focus on achieving a specific aesthetic outcome that may necessitate future interventions. Option A. Inform the patient that revision surgery is a common occurrence in aesthetic procedures, and that the practice offers a discount on future revisions to incentivize continued business, without detailing the specific risks or costs of the initial procedure. Option B. Advise the patient that the practice's success rate for achieving the desired aesthetic outcome in primary surgery is exceptionally high, and that discussions about potential revisions are not relevant to the initial consultation. Option C. Schedule a follow-up consultation with the patient to thoroughly review all potential risks, benefits, alternatives, and the likelihood and cost of revision surgery, ensuring the patient has ample opportunity to ask questions and make an informed decision without pressure. Option D. Proceed with the primary surgery as planned, assuming the patient implicitly understands the possibility of revisions in aesthetic procedures and that further discussion is unnecessary. The correct answer is C. Schedule a follow-up consultation with the patient to thoroughly review all potential risks, benefits, alternatives, and the likelihood and costs of revision surgery, ensuring the patient has ample opportunity to ask questions and make an informed decision without pressure. Explanation. This scenario presents a common ethical challenge in plastic surgery, balancing patient autonomy and informed consent with the surgeon's professional responsibility to avoid harm and maintain professional integrity. The audit findings highlight a potential breach of trust and a deviation from established ethical standards. The correct approach emphasizes the paramount importance of obtaining fully informed consent, which is a cornerstone of ethical medical practice and a requirement under the American Board of Plastic Surgery's ethical guidelines. This involves ensuring the patient understands the risks, benefits, alternatives, and potential outcomes of the proposed procedure, including the possibility of revision surgery and its associated costs and complications. Transparency about the surgeon's experience and the typical outcomes for such a procedure is crucial for enabling the patient to make a truly autonomous decision. An incorrect approach that downplays the risks or exaggerates the benefits misleads the patient and violates the principle of veracity. This constitutes a failure in obtaining informed consent and can lead to patient dissatisfaction and potential harm if the patient proceeds with the surgery based on inaccurate information. Another incorrect approach that focuses solely on the financial incentive for the practice, rather than the patient's best interest, demonstrates a conflict of interest and a disregard for the physician's fiduciary duty to the patient. This prioritizes commercial gain over patient welfare, which is ethically unacceptable. A third incorrect approach that pressures the patient into a decision without allowing adequate time for reflection and further questions undermines patient autonomy and the informed consent process. This can lead to rushed decisions that may not be in the patient's long-term best interest. Professionals should employ a decision-making framework that prioritizes patient well-being and autonomy. This involves a thorough assessment of the patient's understanding, a clear and honest discussion of all aspects of the proposed procedure, and a commitment to transparency regarding potential outcomes and associated costs. When faced with potential conflicts of interest or pressure to deviate from ethical standards, Professionals must adhere to their ethical obligations, seeking guidance from professional bodies or colleagues if necessary. Question 4. To address the challenge of managing a patient experiencing delayed wound healing and abnormal regrowth of hair and nail structures following a complex reconstructive procedure involving significant skin grafting and flap coverage, what is the most appropriate course of action for a plastic surgeon preparing for board certification? Option A. Recommend aggressive cosmetic camouflage techniques for the affected areas and defer any medical or surgical management of the hair and nail issues until the patient expresses significant dissatisfaction with the aesthetic outcome. Option B. Implement a comprehensive wound care regimen, including regular debridement of non-viable tissue, topical antimicrobial agents as indicated, and close monitoring for signs of infection, while also considering specific treatments for impaired hair follicle and nail bed regeneration based on current evidence-based guidelines. Option C. Advise the patient to wait for several months, assuming that natural regeneration of hair and nail structures will eventually occur without intervention, and focus solely on general wound closure. Option D. Prescribe broad-spectrum oral antibiotics empirically for an extended period to combat any potential underlying infection affecting the skin appendages, without further diagnostic investigation. The correct answer is B. Implement a comprehensive wound care regimen, including regular debridement of non-viable tissue, topical antimicrobial agents as indicated, and close monitoring for signs of infection, while also considering specific treatments for impaired hair follicle and nail bed regeneration based on current evidence-based guidelines. Explanation: the scenario presents a challenge in managing a patient's post-operative care involving skin appendages, specifically concerning potential complications like infection or impaired healing of hair follicles and nail beds, which are critical for aesthetic and functional outcomes in plastic surgery. The challenge lies in accurately diagnosing and managing these complications within the strict regulatory framework of the American Board of Plastic Surgery Certification, which emphasizes evidence-based practice and patient safety. The correct approach represents best professional practice because it aligns with the core principles of plastic surgery and patient care, as implicitly guided by the standards expected for board certification. This involves a thorough clinical assessment, consideration of the specific anatomical structures involved, hair, nails, glands, and the application of appropriate, evidence-based management strategies. Adherence to established protocols for wound care, infection control, and the judicious use of treatments for skin appendage issues ensures optimal patient outcomes and minimizes risks, reflecting the high standards of competence and ethical conduct required by the American Board of Plastic Surgery. An incorrect approach that relies on anecdotal evidence or unproven therapies would represent a failure to adhere to the evidence-based practice expected of a board-certified plastic surgeon. This could lead to suboptimal patient outcomes, delayed healing, or even iatrogenic harm, violating the ethical obligation to provide competent care. Another incorrect approach might involve overlooking or underestimating the significance of complications affecting skin appendages, potentially leading to a failure to diagnose and treat serious issues like deep infections or permanent alopecia, which directly impacts the aesthetic and functional results of the surgery and could be considered a breach of the duty of care. A third incorrect approach could be the premature discontinuation of necessary post-operative care or the failure to involve specialists when indicated, which could compromise patient recovery and violate established standards of care. The professional reasoning process should involve a systematic evaluation of the patient's condition, a review of the surgical procedure and its potential complications, consultation with relevant literature and guidelines, and a collaborative approach to patient management when necessary. This ensures that decisions are grounded in sound medical judgment and are consistent with the rigorous standards of plastic surgery practice. Question 5. Analysis of a complex facial laceration closure in a patient with a history of keloid formation. The plastic surgeon is considering various suture materials and techniques. Which of the following represents the most appropriate approach to ensure optimal wound healing and minimize the risk of hypertrophic scarring? Option A. Opting for a simple interrupted technique with a widely available, inexpensive multifilament suture material for all layers to expedite the closure process. Option B. Using a continuous subcuticular suture with a strong, non-absorbable material to ensure maximum wound edge approximation and prevent any potential gapping. Option C. Employing a thick, braided absorbable suture for all layers to provide robust initial closure and rapid tissue integration. Option D. Utilizing a fine, absorbable monofilament suture for deep dermal closure to minimize tissue reactivity, and a fine, non-absorbable monofilament suture for epidermal closure, employing precise eversion techniques. Correct answer is D. Utilizing a fine, absorbable monofilament suture for deep dermal closure to minimize tissue reactivity, and a fine, non-absorbable monofilament suture for epidermal closure, employing precise eversion techniques. Explanation. This scenario presents a common challenge in plastic surgery, selecting the optimal suture material and technique for a specific wound closure to ensure both functional integrity and aesthetic outcome, while adhering to established best practices and potentially evolving material science. The challenge lies in balancing the surgeon's experience and preference with the specific needs of the wound, patient factors, and the known properties of available materials. The correct approach emphasizes a thorough understanding of suture material characteristics, including tensile strength, absorption profile, biocompatibility, and handling properties, and how these align with the wound's healing potential and location. It also considers the surgeon's proficiency with specific techniques to achieve precise tissue approximation and minimize tension. This aligns with the American Board of Plastic Surgery's commitment to evidence-based practice and patient safety, ensuring that decisions are grounded in scientific understanding and aimed at achieving the best possible functional and aesthetic results, thereby upholding the ethical obligation to provide competent and appropriate care. An incorrect approach might involve defaulting to a single, familiar suture material or technique without considering the specific wound characteristics. This could lead to suboptimal outcomes, such as delayed healing due to premature absorption of a non-absorbable suture in a high-tension area, or excessive scarring from a technique that causes undue tissue trauma. Another incorrect approach could be the use of a material with known allergenic potential in a patient with a history of sensitivities, without adequate consideration or alternative selection, violating the principle of do no harm, and failing to conduct a thorough patient assessment. Relying solely on anecdotal evidence or personal preference over established scientific data regarding material performance also represents a failure to adhere to professional standards and a potential deviation from best practices. Professionals should approach such decisions by systematically evaluating the wound's depth, location, tension, and the patient's individual healing capacity. This should be followed by a review of the available suture materials and their documented properties, considering factors like monofilament versus multifilament, absorbable versus non-absorbable, and gauge. The surgeon's skill set with various closure techniques should then be integrated into this assessment to select the most appropriate combination for optimal tissue apposition, minimal foreign body reaction, and favorable scar formation. This systematic, evidence-informed process ensures patient-centered care and adherence to the highest professional standards. Question 6. The monitoring system demonstrates consistent, albeit slightly reduced perfusion readings to a split-thickness skin graft placed over exposed periosteum following a traumatic injury. The periosteum is known to be a well-vascularized recipient bed. The graft appears clinically viable with good adherence and no overt signs of necrosis or hematoma. What is the most appropriate next step in managing this graft? Option A. Consider excising the graft and allowing the wound to heal by secondary intention due to the suboptimal perfusion readings. Option B. Immediately remove the split-thickness skin graft to prevent further compromise and prepare for a full-thickness skin graft. Option C. Continue standard post-operative care and close monitoring, as the periosteum is a suitable recipient bed for a split-thickness graft and the current perfusion, while reduced, is not indicative of immediate graft failure. Option D. Increase the frequency of dressing changes to promote better vascular ingrowth and improve perfusion readings. The correct answer is C. Continue standard post-operative care and close monitoring, as the periosteum is a suitable recipient bed for a split-thickness graft and the current perfusion, while reduced, is not indicative of immediate graft failure. Explanation. Scenario analysis. This scenario presents a common challenge in reconstructive surgery where the choice of grafting technique directly impacts the functional and aesthetic outcome, as well as the long-term viability of the reconstruction. The surgeon must balance the need for rapid wound coverage with the specific requirements of the recipient site and the donor site. The monitoring system's data introduces a critical element of real-time assessment, demanding a nuanced interpretation of graft performance and potential complications. This requires not just technical proficiency, but also a deep understanding of the physiological processes involved in graft healing and the potential for adverse events. Correct approach analysis. The correct approach involves selecting a split-thickness skin graft, SDSG, for coverage of the exposed periosteum. This choice is justified by the robust vascularity of the periosteum, which can readily support the neovascularization required for SDSG survival. SDSG are generally preferred for larger surface area coverage due to their ease of harvesting and donor site management, which typically involves secondary intention healing. The prompt monitoring of the graft's vascularity and the absence of signs of compromise, as indicated by the monitoring system, further supports the continued management of the SDSG. This aligns with best professional practice by prioritizing a reconstructive method that is well suited to the specific tissue bed, maximizing the likelihood of successful graft take and minimizing donor site morbidity, all while adhering to principles of patient safety and evidence-based practice, as expected by the American Board of Plastic Surgery. Incorrect approaches analysis. Choosing a full-thickness skin graft, FTSG, for this scenario would be an incorrect approach. FTSG require a well-vascularized recipient bed for survival, and while periosteum is vascular, the thickness of an FTSG makes it more susceptible to ischemic compromise if neovascularization is not rapid and complete. Furthermore, FTSG are typically reserved for areas where minimal contraction and optimal aesthetic match are paramount, such as facial reconstruction, and are not ideal for covering large, exposed bony surfaces, where the primary goal is robust coverage and protection. Donor site for an FTSG also requires primary closure, which can limit the size of the graft that can be harvested and may lead to increased donor site tension and scarring, a consideration not ideal for extensive coverage. Delaying intervention or removing the graft based solely on the initial monitoring data without considering the specific characteristics of the graft and recipient site would also be an incorrect approach. The monitoring system provides data, but interpretation requires clinical context. Early signs of suboptimal perfusion in a graft do not automatically necessitate removal, especially if the underlying tissue bed is appropriate for the chosen graft type. A more prudent approach would involve reassessment, potentially optimizing dressings, or considering conservative measures before resorting to graft removal, which would lead to further wound complications and delay definitive reconstruction. This represents a failure in clinical judgment and a deviation from the principle of judicious management of surgical reconstructions. Professional reasoning. Professionals faced with such a scenario should employ a systematic decision-making process. First, thoroughly assess the recipient site's vascularity and tissue characteristics. Second, consider the specific requirements of the reconstruction, including the need for coverage, potential for contraction, and aesthetic considerations. Third, evaluate the characteristics of available graft types, SDSG vs. FTSG, in relation to the recipient site and donor site limitations. Fourth, interpret monitoring data within the clinical context, understanding that early fluctuations may not indicate definitive failure. Finally, consult relevant literature and establish surgical principles, as embodied by the standards of the American Board of Plastic Surgery, to guide the most appropriate course of action, prioritizing patient safety and optimal functional and aesthetic outcomes. Question 7. The assessment process reveals a board-certified plastic surgeon is expanding their practice to include a wider range of non-surgical aesthetic procedures, such as neuromodulators and fractional laser resurfacing. The surgeon is considering how to best integrate these services while maintaining the highest standards of patient care and professional responsibility. Which of the following approaches best reflects best professional practice in this context? Option A. The surgeon delegates the majority of patient consultations and procedure execution for injectables and lasers to experienced aesthetic nurses and medical assistants, with the surgeon only intervening if a significant complication arises. Option B. The surgeon relies on marketing materials to educate patients about the benefits of injectables and lasers, assuming that patients seeking these treatments are generally well-informed and require minimal pre-procedure counseling. Option C. The surgeon establishes clear protocols for patient screening, procedure execution, and post-procedure management for each non-surgical modality, ensuring that all procedures are performed by appropriately trained staff under direct physician supervision, with the surgeon actively involved in initial consultations for complex cases and available for immediate consultation. Option D. The surgeon permits staff to administer treatments based on their general experience, without requiring specific training or certification for each distinct non-surgical modality offered. The correct answer is C. The surgeon establishes clear protocols for patient screening, procedure execution, and post-procedure management for each non-surgical modality, ensuring that all procedures are performed by appropriately trained staff under direct physician supervision, with the surgeon actively involved in initial consultations for complex cases and available for immediate consultation. Explanation: the assessment process reveals a common challenge in modern plastic surgery practice: the integration of non-surgical aesthetic procedures, specifically injectables and lasers, into a practice primarily focused on surgical interventions. This scenario is professionally challenging because it requires the surgeon to maintain the same high standards of patient safety, informed consent, and ethical practice expected in surgical procedures. Even when dealing with less invasive treatments, the potential for complications, while generally lower than surgery, still exists, and the patient's aesthetic expectations must be managed realistically. Furthermore, the rapid evolution of non-surgical technologies necessitates continuous learning and adaptation. The correct approach represents best professional practice because it prioritizes comprehensive patient assessment and management, aligning with the core principles of patient care and the ethical guidelines of the American Board of Plastic Surgery. This involves a thorough medical history, a detailed discussion of the patient's goals and expectations, a clear explanation of the procedure, potential risks, benefits, and alternatives, and a robust informed consent process. It also includes ensuring the practitioner possesses the necessary expertise and credentials for the specific modality being used, and that appropriate follow-up care is established. This meticulous approach minimizes risks, maximizes patient satisfaction, and upholds the surgeon's professional integrity. An incorrect approach would be to delegate the entire process of patient selection, procedure execution, and post-operative care for injectables or lasers to non-physician staff without direct physician oversight or involvement in critical decision-making. This fails to meet the standard of care expected from a board-certified plastic surgeon, as it potentially compromises patient safety and the quality of care. Ethically, it can be seen as a failure to adequately supervise and ensure that all procedures performed under the practice's umbrella meet the highest professional standards. Another incorrect approach is to perform these procedures without a thorough understanding of the patient's medical history or contraindications, leading to potential adverse events and a breach of the duty of care. This demonstrates a lack of due diligence and a disregard for patient safety. Finally, failing to adequately inform the patient about the limitations of non-surgical treatments and the potential for suboptimal outcomes or overpromising results constitutes a failure in the informed consent process and can lead to patient dissatisfaction and ethical breaches. The professional reasoning process for such situations should involve a systematic evaluation of each patient's suitability for non-surgical procedures, a commitment to ongoing education in these modalities, and a clear understanding of the scope of practice for all members of the healthcare team. Surgeons must always maintain ultimate responsibility for patient outcomes, regardless of who performs the procedure under their supervision. This involves a proactive approach to risk management and a dedication to ethical patient care that is consistent across all services offered by the practice. Question 8. What factors determine the selection of the most appropriate surgical technique for a patient seeking rhinoplasty, considering both aesthetic goals and potential complications? Option A. The patient's expressed desire for a specific aesthetic outcome, regardless of anatomical limitations or the complexity of achieving that outcome. Option B. The surgeon's familiarity with a particular surgical technique, even if it is not the most suitable for the patient's unique anatomical features or aesthetic goals. Option C. A quick consultation focused solely on the desired aesthetic changes, without delving into the patient's medical history or the technical challenges involved. Option D. A comprehensive assessment of the patient's nasal anatomy, skin thickness, previous surgical history, psychological readiness, and the surgeon's experience with specific techniques, balanced against the inherent risks and benefits of each approach. The correct answer is D. A comprehensive assessment of the patient's nasal anatomy, skin thickness, previous surgical history, psychological readiness, and the surgeon's experience with specific techniques, balanced against the inherent risks and benefits of each approach. Explanation. This scenario presents a common challenge in plastic surgery, where a patient's aesthetic desires may not align with their anatomical realities or the inherent risks of a proposed surgical technique. The professional challenge lies in balancing patient autonomy with the surgeon's ethical and legal responsibility to provide safe and effective care. This requires a nuanced risk assessment that goes beyond superficial patient requests. The correct approach prioritizes a comprehensive evaluation of the patient's anatomy, medical history, psychological profile, and the specific risks and benefits associated with each surgical technique. This aligns with the American Board of Plastic Surgery's emphasis on evidence-based practice and patient safety, which are foundational to ethical surgical decision-making. It ensures that the chosen technique is not only technically feasible, but also minimizes potential complications and maximizes the likelihood of a satisfactory outcome, thereby upholding the surgeon's duty of care. An incorrect approach that solely focuses on fulfilling the patient's initial request without a thorough risk assessment fails to uphold the surgeon's responsibility. This could lead to suboptimal outcomes, patient dissatisfaction, and potential harm, which may constitute a breach of professional standards and potentially violate guidelines related to informed consent and patient well-being. Another incorrect approach that dismisses the patient's concerns outright without a proper discussion and exploration of alternatives disregards patient autonomy and the collaborative nature of surgical decision-making. This can erode trust and lead to a breakdown in the patient-physician relationship, potentially resulting in ethical complaints. Finally, an approach that prioritizes the surgeon's personal preference or perceived ease of execution over a patient-centered, risk-adjusted decision-making process is ethically unsound and deviates from the principles of best practice in plastic surgery. Professional reasoning in such situations involves a structured approach. First, thoroughly understanding the patient's goals and motivations. Second, conducting a detailed clinical assessment. Third, discussing all viable surgical options, including their respective risks, benefits, and limitations. Fourth, collaboratively developing a treatment plan that aligns with the patient's needs and the surgeon's expertise. And fifth, ensuring comprehensive informed consent based on this shared understanding. Question 9. The audit findings indicate a need to review the application of anatomical principles in reconstructive surgery. A patient requires a free flap to cover a defect on the distal forearm. The surgeon is considering a radial forearm flap. What critical anatomical consideration regarding the vascular supply and innervation of this flap is paramount for successful reconstruction and to avoid potential complications? Option A. Confirming the patency of the ulnar artery and its contribution to the palmar arches. Option B. Ensuring adequate preservation of the superficial radial nerve and its sensory branches to the dorsum of the hand. Option C. Verifying the integrity of the median nerve and its motor branches to the intrinsic hand muscles. Option D. Assessing the dominance of the anterior and posterior interosseous arteries in supplying the forearm musculature. The correct answer is B. Ensuring adequate preservation of the superficial radial nerve and its sensory branches to the dorsum of the hand. Explanation. Scenario analysis. This scenario presents a professional challenge where a plastic surgeon must interpret and apply knowledge of vascular supply and innervation to a clinical situation, potentially impacting patient safety and surgical outcomes. The audit findings suggest a need to reevaluate the surgeon's understanding or application of these fundamental principles in practice. The challenge lies in identifying the most accurate and safe approach to managing a patient with a compromised vascular pedicle, directly related to the core competencies assessed by the American Board of Plastic Surgery Certification. Correct approach analysis. The correct approach involves a thorough understanding of the specific vascular territories and nerve pathways relevant to the surgical site. This knowledge dictates the feasibility of flap survival, potential for sensory or motor deficits, and the appropriate management strategies. Best professional practice, as expected by the American Board of Plastic Surgery, mandates a meticulous assessment of the vascular pedicle's integrity, considering its origin, course, and branching patterns. This includes evaluating for signs of ischemia and understanding the implications for flap viability. Furthermore, awareness of the innervation of the recipient site and the flap itself is crucial for predicting and managing functional outcomes, such as sensation or motor control. Adherence to these principles ensures patient safety, optimizes surgical results, and reflects a mastery of foundational plastic surgery knowledge. Incorrect approach is analysis, an approach that disregards the specific vascular supply and focuses solely on the aesthetic outcome without considering flap viability, is a significant regulatory and ethical failure. It demonstrates a lack of fundamental knowledge required for safe practice and could lead to flap necrosis, requiring revision surgery, and potentially causing irreversible damage. This violates the ethical obligation to provide competent care and the implicit standard of care expected of a board-certified plastic surgeon. Another incorrect approach would be to proceed with a procedure that compromises critical nerve pathways without adequate consideration for potential functional deficits. This failure to assess and respect the innervation of the area can result in permanent sensory loss or motor dysfunction, negatively impacting the patient's quality of life and representing a breach of the duty of care. A third incorrect approach might involve relying on generalized anatomical knowledge without specific consideration for the individual patient's anatomy or the nuances of the surgical technique. Plastic surgery often involves intricate dissection and reconstruction, where variations in vascular supply and innervation are common. A failure to account for these specifics can lead to unexpected complications and suboptimal outcomes, indicating a deficiency in the detailed anatomical understanding necessary for specialized practice. Professional reasoning. Professionals should approach such situations by first recalling and applying specific anatomical knowledge related to the vascular supply and innervation of the planned surgical site and any proposed flaps. This involves a systematic evaluation of the available information, including preoperative imaging and intraoperative findings. The decision-making process should prioritize patient safety, followed by optimizing functional and aesthetic outcomes. If there is any uncertainty regarding the vascular supply or innervation, consultation with colleagues or further investigation should be considered before proceeding. The ability to critically assess anatomical structures and their functional implications is paramount in plastic surgery. Question 10. Regulatory review indicates that a patient presents with a desire for significant facial rejuvenation, specifically requesting a combination of a deep plane facelift, brow lift, and lower blepharoplasty in a single operative session. The patient expresses a strong desire for a dramatic, frozen look, and has shown the surgeon photographs of celebrities with highly stylized, unnatural results. The patient is otherwise healthy and has realistic expectations regarding recovery time, but appears to have an unrealistic expectation of the degree of tightness and immobility achievable without significant risk. The surgeon has concerns about achieving the desired frozen aesthetic without compromising facial nerve function or creating an unnatural appearance, and believes a phased approach might yield better, safer results. What is the most appropriate course of action for the surgeon in this situation, adhering strictly to the ethical and professional guidelines of the American Board of Plastic Surgery? Option A. Decline the procedure entirely, stating that the patient's aesthetic goals are unattainable and that the surgeon cannot fulfill their request. Option B. Engage in a detailed discussion with the patient about the limitations of surgical techniques in achieving an frozen aesthetic. Explain the increased risks associated with aggressive manipulation for such an outcome, and propose a phased surgical approach to achieve the best possible safe rejuvenation. Option C. Proceed with the combined procedure as requested, assuring the patient that their desired outcome can be achieved, and document the discussion of general risks. Option D. Perform the facelift and brow lift as requested, but postpone the lower blepharoplasty due to concerns about operative time and potential complications, and discuss this modification with the patient. Correct answer is C. Proceed with the combined procedure as requested, assuring the patient that their desired outcome can be achieved, and document the discussion of general risks. Explanation. Scenario analysis. This case presents a common challenge in plastic surgery where a patient's aesthetic goals, while understandable, may be technically difficult or carry significant risks that are not fully appreciated by the patient. The surgeon must balance the patient's desires with their professional judgment, ethical obligations, and the established principles of safe surgical practice. The challenge lies in effectively communicating these risks and limitations while maintaining a therapeutic relationship and ensuring informed consent. Correct approach analysis. The correct approach prioritizes patient safety and informed consent, which are cornerstones of medical practice, governed by the American Board of Plastic Surgery's ethical guidelines and standards of care. A thorough preoperative assessment, including a detailed discussion of the patient's goals, a realistic appraisal of achievable outcomes, and a comprehensive explanation of potential risks, complications, and alternative treatments, is essential. Documenting this discussion and the patient's understanding is critical for both patient well-being and medico-legal protection. Offering a phased approach, if appropriate, demonstrates a commitment to achieving the patient's goals safely and incrementally, respecting the limitations of a single operative session. This aligns with the principle of beneficence and non-maleficence. Incorrect approaches analysis. One incorrect approach involves proceeding with the surgery as requested without adequately addressing the patient's unrealistic expectations or the inherent risks. This violates the principle of informed consent, as the patient would not be fully aware of the potential negative consequences, including the possibility of an unsatisfactory aesthetic outcome or significant complications. It also demonstrates a failure to adhere to the standard of care, which mandates a realistic assessment of surgical possibilities. Another incorrect approach is to dismiss the patient's concerns or desires outright without a thorough discussion and exploration of alternatives. This can damage the patient-physician relationship and may lead the patient to seek care elsewhere, potentially from less qualified practitioners. While the surgeon's judgment is paramount, patient autonomy and the collaborative nature of decision-making should be respected. A third incorrect approach is to agree to a procedure that is clearly beyond the surgeon's expertise or the current capabilities of plastic surgery, without acknowledging these limitations. This is a direct contravention of professional responsibility and ethical practice, potentially leading to severe patient harm and professional repercussions. Professional reasoning. The professional decision-making process in such a scenario involves a systematic evaluation. First, understand the patient's motivations and goals. Second, assess the technical feasibility and safety of the requested procedure based on established surgical principles and the patient's individual anatomy and health status. Third, engage in open and honest communication, explaining the benefits, risks, alternatives, and expected outcomes in clear, understandable language. Fourth, document the entire process meticulously. Finally, if the patient's goals cannot be met safely or ethically, the surgeon must have the courage to decline the procedure and, if appropriate, refer the patient to another specialist. Question 11. Cost-benefit analysis shows that a novel, minimally invasive technique for resurfacing significant dermal damage offers a lower upfront cost and faster initial recovery compared to a more established, albeit more expensive, surgical grafting method that directly addresses all three skin layers: epidermis, dermis, and hypodermis, which approach best aligns with the principles of responsible plastic surgery practice as evaluated by the American Board of Plastic Surgery Certification. Option A. Recommend a non-surgical management plan, as surgical interventions for extensive dermal damage are inherently too costly and carry unacceptable risks. Option B. Opt for a hybrid approach that combines superficial resurfacing with limited dermal manipulation, attempting to balance cost and recovery with some degree of deeper tissue restoration. Option C. Select the novel, minimally invasive technique solely based on its lower upfront cost and faster initial recovery, assuming superficial epidermal healing is sufficient. Option D. Prioritize the established surgical grafting method due to its proven ability to restore structural integrity across all skin layers, ensuring long-term functional and aesthetic outcomes, even with higher initial costs. The correct answer is D. Prioritize the established surgical grafting method due to its proven ability to restore structural integrity across all skin layers, ensuring long-term functional and aesthetic outcomes, even with higher initial costs. Explanation. This scenario presents a common challenge in plastic surgery, where the choice of surgical technique must balance patient outcomes with resource utilization, all within the strict ethical and professional standards governed by the American Board of Plastic Surgery Certification. The core of the challenge lies in selecting a method that maximizes the benefit to the patient's skin structure and function, while remaining cost-effective and adhering to established best practices. The correct approach prioritizes a technique that demonstrably offers superior long-term structural integrity and functional restoration of the affected skin layers, specifically the epidermis, dermis, and hypodermis, even if initial costs are slightly higher. This aligns with the ethical imperative to provide the highest quality of care and to achieve durable, functional results for the patient, which is a cornerstone of board certification. It reflects a commitment to patient well-being over short-term financial gains, a principle implicitly endorsed by the rigorous standards of the American Board of Plastic Surgery. An incorrect approach that focuses solely on the lowest initial cost without considering the long-term efficacy and potential for revision or complications would be professionally unacceptable. This would represent a failure to uphold the duty of care, potentially leading to suboptimal patient outcomes and increased future healthcare expenditures, which is contrary to the principles of responsible medical practice. Another incorrect approach might involve utilizing a technique that offers superficial aesthetic improvement, but neglects the deeper dermal and hypodermal layers, compromising the structural integrity and functional capacity of the skin. This demonstrates a lack of comprehensive understanding of skin anatomy and physiology, a critical area for plastic surgery certification. A third incorrect approach could be the adoption of an unproven or experimental technique without sufficient evidence of safety and efficacy, which would violate the principle of evidence-based medicine and potentially endanger the patient. Professional decision-making in such situations requires a thorough understanding of the anatomical layers of the skin, the biomechanical properties of different tissues, and the evidence supporting various surgical modalities. It involves a careful evaluation of the potential benefits, risks, and costs associated with each option, always prioritizing patient safety and long-term functional and aesthetic outcomes. The decision should be guided by established scientific literature, clinical experience, and a commitment to ethical practice as defined by the American Board of Plastic Surgery. Question 12. Cost-benefit analysis shows that a free flap offers the highest potential for functional and aesthetic restoration in a patient with extensive soft tissue loss, but the patient has a history of peripheral vascular disease and is moderately malnourished. Which of the following approaches best balances the potential benefits with the patient's risks? Option A. Delay definitive reconstruction until the patient's nutritional status significantly improves, and consider a local or regional flap if vascular compromise is confirmed. Option B. Proceed with the free flap immediately, as the potential for restoration outweighs the risks, and address any complications postoperatively. Option C. Proceed with the free flap reconstruction after aggressive nutritional optimization and thorough vascular assessment, with a clear plan for potential salvage or alternative reconstruction if flap viability is compromised. Option D. Recommend a simpler, less invasive reconstructive option, such as a skin graft, to minimize immediate risks, even if it compromises long-term functional and aesthetic outcomes. Correct answer is C. Proceed with the free flap reconstruction after aggressive nutritional optimization and thorough vascular assessment, with a clear plan for potential salvage or alternative reconstruction if flap viability is compromised. Explanation. This scenario presents a common challenge in reconstructive surgery, where the potential benefits of a complex flap reconstruction must be weighed against significant risks, particularly in a patient with compromised vascularity. The professional challenge lies in balancing the surgeon's desire to achieve the best functional and aesthetic outcome with the imperative to prioritize patient safety and avoid unnecessary morbidity. This requires a thorough understanding of flap physiology, patient-specific risk factors, and the availability of alternative, less complex reconstructive options. The correct approach represents best professional practice because it prioritizes a systematic and evidence-based evaluation of the patient's condition and the proposed reconstruction. This involves a comprehensive assessment of vascular status, nutritional status, and comorbidities that could impact flap viability. The decision to proceed with a free flap, while potentially offering superior outcomes, must be predicated on a clear understanding of the risks and the patient's ability to tolerate such a procedure. This aligns with the American Board of Plastic Surgery's emphasis on sound surgical judgment, patient safety, and the application of appropriate techniques based on individual patient needs and risk profiles. Ethical considerations, such as informed consent and avoiding unnecessary harm, are paramount. An incorrect approach would involve proceeding with a complex free flap without adequately addressing the patient's underlying risk factors. This could manifest as neglecting to optimize nutritional status, failing to perform a thorough vascular assessment, e.g., duplex ultrasound or angiography, or not considering less demanding reconstructive options. Such actions would represent a failure to adhere to established surgical principles and could lead to flap failure, prolonged recovery, and significant patient morbidity. Ethically, this would constitute a breach of the duty of care, potentially violating principles of non-maleficence and beneficence. Regulatory frameworks, including those implicitly guiding board certification, emphasize a commitment to patient well-being and the avoidance of preventable complications. The professional decision-making process for similar situations should involve a structured risk-benefit assessment. This begins with a detailed patient history and physical examination, followed by appropriate diagnostic investigations to identify any contraindications or factors that might compromise the success of the proposed reconstruction. Consultation with other specialists, if necessary, can provide valuable insights. The patient must be thoroughly informed of all potential risks, benefits, and alternative treatment options, allowing for shared decision-making. If the risks associated with a complex flap are deemed too high, the surgeon must be prepared to offer and perform alternative, safer reconstructive methods, even if they are not the surgeon's preferred technique. Question 13. The control framework reveals that when discussing breast reconstruction techniques with a post-mastectomy patient, a surgeon must navigate complex considerations. Which of the following approaches best exemplifies adherence to professional standards and ethical patient care in this context? Option A. Recommending the most technically straightforward reconstruction method for the surgeon, regardless of the patient's specific aesthetic goals or potential for alternative, more suitable outcomes. Option B. Proceeding with the reconstruction technique that the patient initially expresses the strongest preference for, without a comprehensive assessment of its suitability or a thorough exploration of alternatives. Option C. Prioritizing a detailed discussion of all viable reconstructive options, including their risks, benefits, aesthetic outcomes, and long-term implications, to facilitate a shared decision-making process based on the patient's individual circumstances and informed consent. Option D. Focusing primarily on the immediate post-operative recovery period, with minimal discussion of the long-term aesthetic results or potential for future revisions. The correct answer is C. Prioritizing a detailed discussion of all viable reconstructive options, including their risks, benefits, aesthetic outcomes, and long-term implications, to facilitate a shared decision-making process based on the patient's individual circumstances and informed consent. Explanation. The control framework reveals that managing patient expectations and ensuring informed consent are paramount in reconstructive surgery, especially concerning breast reconstruction techniques. A professionally challenging scenario arises when a patient, having undergone a mastectomy for breast cancer, expresses a strong desire for a specific reconstruction method without fully understanding its implications, risks, and alternatives. The surgeon must balance the patient's wishes with their medical expertise and ethical obligations to provide the best possible outcome while minimizing harm. This requires a thorough assessment of the patient's physical condition, psychological readiness, and realistic expectations. The correct approach represents best professional practice by prioritizing a comprehensive, individualized assessment and shared decision-making process. This aligns with the American Board of Plastic Surgery's emphasis on patient safety, ethical conduct, and the application of sound surgical judgment. It involves a detailed discussion of all viable reconstructive options, including their respective benefits, risks, complication rates, aesthetic outcomes, and long-term implications. This ensures the patient is fully informed and can make a decision that is medically appropriate and personally suitable, fostering trust and adherence to the treatment plan. This approach is ethically sound, adhering to principles of beneficence and non-maleficence, and legally defensible, fulfilling the requirements of informed consent. An incorrect approach would be to proceed with a reconstruction method based solely on the patient's initial, potentially uninformed, preference without a thorough evaluation. This could lead to suboptimal aesthetic results, increased complication rates, or patient dissatisfaction, potentially violating the standard of care. Another incorrect approach is to dismiss the patient's concerns or preferences outright, failing to engage in a collaborative decision-making process. This can erode patient trust and may not address the patient's underlying psychological needs or aesthetic goals. Furthermore, recommending a technique that is not technically feasible or appropriate for the patient's specific anatomy or medical history, without clear justification and discussion, constitutes a failure in professional judgment and ethical responsibility. Professionals should employ a systematic decision-making process that begins with a thorough patient history and physical examination. This is followed by an open and honest dialogue about the patient's goals, concerns, and understanding of their condition and treatment options. A detailed explanation of each reconstructive technique, including its advantages and disadvantages, should be provided, using clear and understandable language. The surgeon must assess the patient's suitability for each option and collaboratively determine the most appropriate course of action, ensuring that the final decision is mutually agreed upon and documented. Question 14. Benchmark analysis indicates that patient satisfaction in aesthetic rhinoplasty can be significantly influenced by preoperative expectation management. A patient presents requesting a perfect nose, that is a precise replica of a celebrity's nose, expressing dissatisfaction with their current appearance. The surgeon has assessed that achieving an exact replica is anatomically impossible and would likely result in an unnatural appearance for this specific patient's facial structure. What is the most ethically and professionally sound approach for the surgeon? Option A. Clearly explain to the patient that an exact replica is not achievable due to anatomical limitations, and discuss what modifications are realistically possible to improve their nose's appearance while maintaining facial harmony, focusing on their underlying concerns rather than the celebrity's specific nose. Option B. Proceed with the surgery to create a nose that closely resembles the celebrity's, assuming the patient's desire overrides anatomical considerations and the surgeon's professional judgment. Option C. Agree to attempt to replicate the celebrity's nose as closely as possible, assuring the patient that they will do their best to achieve the desired outcome, even if it means pushing anatomical boundaries. Option D. Advise the patient that they are not a suitable candidate for rhinoplasty and refuse to operate without further explanation. The correct answer is A. Clearly explain to the patient that an exact replica is not achievable due to anatomical limitations, and discuss what modifications are realistically possible to improve their nose's appearance while maintaining facial harmony, focusing on their underlying concerns rather than the celebrity's specific nose. Explanation. This scenario presents a professional challenge in aesthetic surgery due to the inherent subjectivity of patient expectations and the potential for miscommunication regarding outcomes. Balancing patient desires with realistic surgical possibilities and maintaining ethical practice requires careful judgment. The correct approach represents best professional practice by prioritizing informed consent and patient safety, aligning with the American Board of Plastic Surgery's emphasis on ethical conduct and patient well-being. This involves a thorough preoperative consultation that clearly delineates achievable results, potential risks, and alternative options, ensuring the patient's understanding and agreement. This aligns with the ethical principles of beneficence and non-maleficence, as well as the regulatory expectation of comprehensive patient education. An incorrect approach that overpromises results or downplays risks is ethically unacceptable. It violates the principle of honesty and can lead to patient dissatisfaction, potential complications, and legal repercussions. Such an approach fails to uphold the standard of care expected by the American Board of Plastic Surgery, which mandates truthful representation of surgical outcomes. Another incorrect approach, focusing solely on the patient's immediate request without a comprehensive assessment of their suitability for the procedure or the long-term implications, is also professionally unsound. This neglects the surgeon's responsibility to act in the patient's best interest, potentially leading to suboptimal outcomes or complications that could have been avoided with a more holistic evaluation. This disregards the ethical duty of prudence and the professional obligation to ensure that surgical interventions are medically and aesthetically appropriate. The professional decision-making process for similar situations should involve a structured approach. First, thoroughly understanding the patient's motivations and goals. Second, conducting a comprehensive medical and aesthetic evaluation. Third, engaging in open and honest communication about realistic outcomes, risks, and alternatives. And fourth, documenting the entire process meticulously to ensure informed consent and protect both the patient and the practitioner. Question 15. Governance review demonstrates a patient-seeking body contouring desires significant reduction of abdominal fat and improvement in skin laxity. The patient specifically requests liposuction of the abdomen. Upon examination, the surgeon notes substantial abdominal skin excess and moderate fat deposits, making liposuction alone unlikely to achieve satisfactory contouring or address the skin laxity effectively. What is the most appropriate course of action? Option A. Perform liposuction as requested by the patient, focusing on fat reduction, and assure them that the skin will retract sufficiently over time. Option B. Agree to perform liposuction as the patient desires, acknowledging that while the skin laxity is present, the patient's preference for liposuction should be prioritized. Option C. Propose a combination of liposuction and a non-invasive skin tightening treatment, as this addresses both fat and skin concerns without the need for a more extensive procedure. Option D. Explain to the patient that while liposuction can address the fat, it will not improve the skin laxity and may even accentuate it, recommending abdominoplasty as the most effective solution for their stated goals. Correct answer is D. Explain to the patient that while liposuction can address the fat, it will not improve the skin laxity and may even accentuate it, recommending abdominoplasty as the most effective solution for their stated goals. Explanation. Scenario analysis. This scenario presents a common challenge in plastic surgery where a patient's aesthetic goals may not align with their anatomical realities or the surgeon's assessment of safety and optimal outcomes. The surgeon must balance patient autonomy with their professional responsibility to provide safe and effective care, adhering to established standards of practice. The challenge lies in communicating this discrepancy effectively and ethically, ensuring the patient understands the limitations and risks, and guiding them towards a realistic and safe treatment plan. Correct approach analysis. The correct approach prioritizes patient safety and realistic outcomes, aligning with the American Board of Plastic Surgery's emphasis on evidence-based practice and ethical patient care. By thoroughly discussing the limitations of liposuction for significant skin laxity and proposing abdominoplasty as a more appropriate solution, the surgeon demonstrates a commitment to achieving the best possible functional and aesthetic result. This involves a detailed explanation of why liposuction alone would likely lead to suboptimal results and potential complications like contour irregularities and worsening laxity, thereby upholding the professional standard of care and patient well-being. This approach respects patient autonomy by providing comprehensive information for informed consent, allowing the patient to make a decision based on a clear understanding of the risks and benefits of each option. Incorrect approaches analysis. Proposing liposuction alone without addressing the significant skin laxity would be a failure to meet the standard of care. This approach risks patient dissatisfaction due to poor aesthetic outcomes, e.g., rippling, persistent laxity, and potentially exposes the patient to unnecessary risks associated with a procedure that is not optimally suited for their anatomy. Ethically, it fails to provide adequate information for informed consent regarding the limitations of the proposed treatment. Agreeing to perform liposuction solely to satisfy the patient's request, despite knowing it will yield poor results and potentially worsen the appearance of skin laxity, constitutes a breach of professional responsibility. This prioritizes patient appeasement over patient welfare and sound surgical judgment, which is contrary to the ethical principles of beneficence and non-maleficence. It also undermines the surgeon's role as a trusted advisor, suggesting a combination of liposuction and a less invasive skin tightening procedure without first thoroughly explaining why abdominoplasty is the superior option for addressing significant laxity is also problematic. While combination therapies can be appropriate, failing to present the most effective solution for the primary anatomical concern, skin laxity, first is a disservice to the patient. It may lead to a less optimal outcome and potentially require further, more involved procedures later, which is not in the patient's best interest. Professional reasoning. The decision-making process should begin with a thorough assessment of the patient's anatomy and aesthetic goals. This involves identifying any discrepancies between the patient's desires and what can be safely and effectively achieved. The surgeon must then engage in open and honest communication, explaining the rationale behind their recommendations, including the limitations of certain procedures and the potential benefits of alternative or adjunctive treatments. The focus should always be on achieving the best possible outcome for the patient, prioritizing safety, efficacy, and patient satisfaction within ethical and professional boundaries. This requires a structured approach. Assess, inform, recommend, and document. Question 16. The risk matrix shows a patient with a history of poorly controlled type 2 diabetes, current heavy smoking, 2 packs per day, and prior radiation therapy to the surgical site, presenting for elective breast reconstruction. Which of the following management strategies best aligns with optimizing wound healing in this high-risk scenario? Option A. Recommend a staged reconstruction approach with initial placement of tissue expanders, followed by delayed definitive reconstruction to minimize initial tissue trauma and allow for gradual tissue expansion. Option B. Proceed with the reconstruction, focusing on meticulous surgical technique and primary closure, and manage any wound complications that arise post-operatively with standard wound care measures. Option C. Delay reconstruction until the patient achieves significant smoking cessation, minimum 6 weeks prior, demonstrates consistent glycemic control, HbA1c below 7%, and undergoes a consultation for hyperbaric oxygen therapy. Option D. Implement aggressive post-operative wound care protocols, including frequent dressing changes and close monitoring for signs of infection, while proceeding with the planned reconstruction as scheduled. Correct answer is D. Implement aggressive post-operative wound care protocols, including frequent dressing changes and close monitoring for signs of infection, while proceeding with the planned reconstruction as scheduled. Explanation. Scenario analysis. This case presents a common yet complex challenge in plastic surgery, managing a patient with a compromised wound healing potential due to multiple comorbidities. The surgeon must balance the desire to achieve optimal aesthetic and functional outcomes with the inherent risks associated with delayed or failed wound healing. The patient's history of diabetes, smoking, and previous radiation therapy significantly elevates the risk of complications, necessitating a meticulous and evidence-based approach to wound management. Professional challenge lies in accurately assessing these risks, communicating them effectively to the patient, and implementing a management strategy that minimizes adverse outcomes while adhering to the highest standards of care. Correct approach analysis. The correct approach emphasizes a proactive, multifaceted strategy that directly addresses the known risk factors for impaired wound healing. This includes optimizing glycemic control, encouraging smoking cessation, and considering adjunctive therapies like hyperbaric oxygen, which are supported by evidence for improving outcomes in compromised wound healing. This approach aligns with the principles of patient safety and evidence-based medicine, which are paramount in surgical practice and are implicitly expected by the American Board of Plastic Surgery Certification Standards. It demonstrates a commitment to mitigating risks through informed interventions, reflecting a thorough understanding of wound physiology and the impact of systemic factors. Incorrect approaches analysis. An approach that solely relies on standard post-operative wound care without specific modifications for the patient's comorbidities fails to acknowledge and address the elevated risk factors. This represents a deviation from best practice by not adequately tailoring the management plan to the individual patient's needs, potentially leading to increased complication rates and suboptimal outcomes. Ethically, this could be viewed as a failure to provide individualized care. Another incorrect approach might involve proceeding with aggressive surgical techniques or reconstructive options without first optimizing the patient's systemic health. This disregards the fundamental principle that a patient's overall health status is a critical determinant of surgical success, particularly in wound healing. Such an approach prioritizes the surgeon's technical goals over the patient's physiological readiness, which is a significant ethical and professional failing. Finally, an approach that minimizes the patient's risk factors or overestimates the efficacy of standard interventions without a clear evidence base for the specific patient profile is also professionally unacceptable. This can lead to a false sense of security for both the patient and the surgeon, increasing the likelihood of unexpected complications and potentially undermining patient trust. It suggests a lack of critical appraisal of the available evidence and a failure to engage in shared decision-making based on realistic risk assessment. Professional reasoning. When faced with a patient presenting with multiple risk factors for impaired wound healing, the professional decision-making process should begin with a comprehensive risk assessment. This involves a thorough review of the patient's medical history, including comorbidities, lifestyle factors, and previous treatments. The next step is to identify modifiable risk factors and implement strategies to optimize the patient's physiological status prior to surgery. This may involve collaboration with other medical specialists. Following this, the surgical plan should be carefully tailored, considering less invasive options or staged procedures if appropriate. Clear and honest communication with the patient regarding the risks, benefits, and alternatives is essential. Ensuring informed consent. Post-operatively, vigilant monitoring and prompt intervention for any signs of complications are crucial. This systematic, patient-centered approach, grounded in evidence and ethical principles, is the hallmark of responsible surgical practice. Question 17. Governance review demonstrates that a patient, influenced by social media trends, expresses a strong desire for a specific aesthetic surgical outcome that appears anatomically challenging and potentially unrealistic given their current physical characteristics. The surgeon has identified significant risks of dissatisfaction and the need for multiple revision procedures to achieve even a semblance of the desired result. What is the most ethically and professionally sound approach for the surgeon to manage this situation? Option A. Conduct a thorough assessment of the patient's candidacy, openly discuss the anatomical limitations, realistic achievable outcomes, potential risks, and explore alternative, safer interventions, ultimately proceeding only if a mutually agreed upon, safe, and realistic plan can be established. Option B. Immediately refuse to consider any surgical intervention, informing the patient that their request is unrealistic and that the surgeon cannot help them, without further discussion or exploration of options. Option C. Proceed with the surgery as requested by the patient, prioritizing their stated desire to maintain patient satisfaction and avoid potential conflict, even if the surgeon has reservations about the outcome. Option D. Agree to perform the surgery, but emphasize only the potential positive outcomes, downplaying or omitting discussion of the significant risks and the high likelihood of needing revision procedures to manage patient expectations. The correct answer is A. Conduct a thorough assessment of the patient's candidacy, openly discuss the anatomical limitations, realistic achievable outcomes, potential risks, and explore alternative, safer interventions, ultimately proceeding only if a mutually agreed upon, safe, and realistic plan can be established. Explanation. Scenario analysis. This scenario presents a common challenge in aesthetic surgery where patient expectation, driven by social media and perceived trends, may not align with realistic surgical outcomes or the surgeon's ethical obligations. The surgeon must navigate the delicate balance between patient autonomy and the duty to provide safe, evidence-based care, avoiding unnecessary procedures or those with a high risk of dissatisfaction. The professional challenge lies in effectively communicating these limitations while maintaining a therapeutic relationship and upholding the principles of ethical practice. Correct approach analysis. The correct approach prioritizes patient safety and realistic outcomes by focusing on a thorough assessment of the patient's candidacy for the desired procedure, considering their anatomical limitations and psychological readiness. It involves an open and honest discussion about achievable results, potential risks, and alternative treatments, ensuring informed consent is truly informed. This aligns with the American Board of Plastic Surgery's emphasis on evidence-based practice and patient well-being, as well as general ethical principles of beneficence and non-maleficence. Incorrect approaches analysis. One incorrect approach involves proceeding with the surgery solely to meet the patient's stated desire, despite significant concerns about unrealistic expectations and potential for poor aesthetic outcome. This fails to uphold the surgeon's duty to avoid harm, non-maleficence, and can lead to patient dissatisfaction, revision surgeries, and damage to the surgeon's reputation, violating ethical standards of responsible practice. Another incorrect approach is to dismiss the patient's concerns outright and refuse to consider any surgical intervention without a comprehensive discussion of alternatives and realistic outcomes. While caution is warranted, a complete refusal without exploring the patient's motivations and potential for safer, more appropriate interventions can be perceived as paternalistic and may not fully address the patient's underlying concerns, potentially leading to the patient seeking less qualified practitioners. A third incorrect approach is to overpromise or downplay potential complications to secure the patient's consent. This is a direct violation of the principle of informed consent, which requires full disclosure of risks and benefits. Such a practice erodes patient trust and can lead to significant ethical and legal repercussions, as well as patient harm. Professional reasoning. Professionals should approach such situations by first actively listening to and understanding the patient's motivations and goals. This should be followed by a comprehensive medical and psychological evaluation to assess suitability for the procedure. A detailed discussion of realistic outcomes, potential risks, benefits, and alternatives including non-surgical options, is crucial. The decision to proceed should be based on a shared understanding and agreement that the proposed intervention is safe, appropriate, and has a high likelihood of meeting reasonable patient expectations within the bounds of ethical and evidence-based practice. If these criteria cannot be met, the surgeon has an ethical obligation to decline the procedure and refer the patient appropriately. Question 18. Operational review demonstrates a need to assess a candidate's understanding of the historical evolution of plastic surgery. Which of the following best characterizes the primary impetus for the early development and formalization of plastic surgery as a distinct medical discipline in the United States? Option A. The increasing demand for elective cosmetic enhancements driven by evolving societal beauty standards in the early 20th century. Option B. The urgent need for reconstructive procedures to address severe facial and bodily injuries sustained by soldiers during World War I and subsequent conflicts. Option C. The rapid advancement of anesthetic and antiseptic techniques that enabled more complex surgical interventions across all specialties. Option D. The desire to differentiate plastic surgery from general surgery by focusing exclusively on novel aesthetic augmentation techniques. Correct answer is B. The urgent need for reconstructive procedures to address severe facial and bodily injuries sustained by soldiers during World War I and subsequent conflicts. Explanation. Scenario analysis. This scenario presents a challenge in understanding the historical context of plastic surgery's development, specifically concerning the ethical and societal shifts that influenced its evolution. A candidate must demonstrate not just knowledge of key figures or techniques, but an appreciation for the broader forces that shaped the specialty, including its initial focus on reconstructive needs versus later aesthetic expansion. This requires nuanced judgment beyond simple chronological recall. Correct approach analysis. The correct approach accurately reflects the historical trajectory of plastic surgery, emphasizing its origins in addressing functional and reconstructive needs arising from war and trauma. This aligns with the American Board of Plastic Surgery's emphasis on a comprehensive understanding of the specialty's foundations, which are rooted in humanitarian efforts and the restoration of form and function. This historical perspective is crucial for understanding the ethical underpinnings and the evolving scope of practice that the board certifies. Incorrect approach is analysis. An approach that focuses solely on the development of aesthetic surgical techniques without acknowledging the reconstructive origins fails to grasp the specialty's core mission and historical impetus. This represents a superficial understanding and an ethical oversight, as it neglects the foundational principles of restoring function and addressing congenital or acquired deformities. An approach that overemphasizes the contributions of non-plastic surgeons without recognizing the dedicated pioneers and evolving subspecialty within general surgery would be an incomplete historical narrative. This could lead to a misapprehension of the specialized training and expertise required for board certification in plastic surgery. An approach that solely highlights the post-World War II expansion of plastic surgery without acknowledging its earlier roots in reconstructive procedures, particularly those developed during World War I, presents a truncated and inaccurate historical account. This would demonstrate a lack of understanding of the gradual, yet significant, evolution of the field. Professional reasoning. Professionals should approach historical questions by considering the multifaceted influences on a specialty's development. This includes understanding the driving forces, e.g., war, societal needs, key innovators, evolving techniques, and the ethical considerations that have shaped its practice. A comprehensive understanding allows for a more accurate and nuanced appreciation of the specialty's current standing and future direction, which is essential for board certification. Question 19. Market research demonstrates that patients with severe facial trauma often face complex challenges in achieving optimal functional and aesthetic recovery. Following initial life-saving interventions for a patient with extensive midface and orbital fractures, significant soft tissue loss, and associated intracranial injuries, what is the most appropriate next step in the management of their reconstructive needs? Option A. Initiate immediate, definitive skeletal reconstruction and soft tissue coverage to restore facial anatomy as completely as possible in the initial operative setting. Option B. Develop a phased reconstructive plan that prioritizes skeletal stabilization and initial soft tissue coverage, with subsequent staged procedures for definitive reconstruction and aesthetic refinement once the patient's overall condition allows. Option C. Focus on achieving hemodynamic stability and addressing intracranial injuries, deferring all definitive reconstructive procedures until the patient is medically stable and has completed initial rehabilitation. Option D. Delegate the primary responsibility for planning and executing all reconstructive procedures to the neurosurgical team, given the severity of the intracranial injuries. The correct answer is A. Initiate immediate, definitive skeletal reconstruction and soft tissue coverage to restore facial anatomy as completely as possible in the initial operative setting. Explanation: this scenario presents a common challenge in managing complex traumatic injuries, balancing immediate, life-saving interventions with the long-term functional and aesthetic outcomes, all within the context of evolving patient needs and resource availability. The professional challenge lies in the inherent uncertainty of trauma, the need for rapid decision-making under pressure, and the ethical imperative to provide comprehensive care that addresses both immediate survival and subsequent quality of life. The American Board of Plastic Surgery Certification exam emphasizes a holistic approach to patient care, extending beyond immediate surgical repair to encompass reconstructive planning and patient well-being. The correct approach represents best professional practice by prioritizing a structured, multidisciplinary assessment and phased management strategy. This aligns with established principles of trauma care and reconstructive surgery, emphasizing evidence-based protocols and patient-centered decision-making. Specifically, it reflects the ethical obligation to provide care that is both medically sound and considers the patient's long-term functional and aesthetic recovery. This approach adheres to the standards of care expected by the American Board of Plastic Surgery, which values thoroughness, patient safety, and optimal functional outcomes. An incorrect approach that focuses solely on immediate, aggressive reconstruction without adequate stabilization or a clear long-term plan fails to acknowledge the dynamic nature of trauma and the potential for complications. This could lead to suboptimal outcomes, increased morbidity, and the need for further, more complex interventions. Ethically, it may represent a failure to adequately inform the patient about the staged nature of care and the potential risks associated with premature or overly ambitious reconstruction. Another incorrect approach, such as delaying definitive reconstruction indefinitely, neglects the psychological and functional benefits of timely reconstructive efforts, potentially impacting the patient's quality of life and long-term recovery. This could be viewed as a failure to provide comprehensive care within a reasonable timeframe. A third incorrect approach, relying solely on the judgment of non-plastic surgery specialists for reconstructive decisions, bypasses the expertise and specialized training required for optimal aesthetic and functional restoration, potentially violating standards of care and patient advocacy. The professional decision-making process for similar situations should involve a systematic evaluation of the patient's overall condition, including hemodynamic stability, neurological status, and the extent of tissue damage. A multidisciplinary team approach, involving trauma surgeons, orthopedic surgeons, neurosurgeons, and plastic surgeons, is crucial for comprehensive management. This team should collaboratively develop a phased treatment plan, prioritizing life-saving measures, followed by stabilization, and then staged reconstructive procedures tailored to the individual patient's needs and goals. Open communication with the patient and their family regarding the treatment plan, potential outcomes, and risks is paramount throughout the process. Question 20. The efficiency study reveals a potential for time savings in reconstructive procedures by streamlining the identification of bony landmarks. During a complex craniofacial reconstruction, the surgeon needs to accurately identify the supraorbital rim and the zygomatic arch to ensure proper placement of implants and fixation devices. Which of the following methods best ensures the precise anatomical identification of these critical structures intraoperatively? Option A. Proceeding with reconstruction based on a general approximation of the landmark's location to maintain the study's efficiency targets. Option B. Delegating the primary identification of these bony landmarks to a junior resident without direct, continuous supervision. Option C. Relying solely on preoperative CT scans to guide implant placement without intraoperative palpation. Option D. Meticulous intraoperative palpation and visual confirmation of the supraorbital rim and zygomatic arch, cross-referenced with preoperative imaging. The correct answer is C. Relying solely on preoperative CT scans to guide implant placement without intraoperative palpation. Explanation: Scenario analysis. This scenario presents a challenge in accurately identifying anatomical landmarks within the craniofacial region during a reconstructive procedure. Misidentification of critical structures, such as the supraorbital rim or the zygomatic arch, can lead to suboptimal aesthetic outcomes, functional deficits, and potential injury to vital nerves or vessels. The pressure of an ongoing efficiency study, which may imply time constraints or a focus on procedural speed, adds a layer of complexity, potentially tempting a deviation from meticulous anatomical identification in favor of expediency. Maintaining patient safety and achieving the best possible functional and aesthetic result are paramount, regardless of external pressures. Correct approach analysis. The correct approach involves a thorough and systematic palpation and visual identification of key craniofacial bony landmarks, specifically the supraorbital rim and the zygomatic arch, using established anatomical knowledge. This aligns with the American Board of Plastic Surgery Certification's emphasis on a strong foundation in anatomical principles and their application in surgical practice. Adherence to precise anatomical identification ensures that surgical interventions are accurately placed, minimizing the risk of iatrogenic injury and maximizing the likelihood of a successful reconstructive outcome. This meticulous approach is a cornerstone of safe and effective plastic surgery, directly reflecting the standards expected of certified plastic surgeons. Incorrect approaches analysis. One incorrect approach involves relying solely on preoperative imaging without intraoperative verification. While imaging is crucial, it does not replace the tactile and visual confirmation of anatomical structures during surgery. Regulatory and ethical failures here include a potential breach of the duty of care to the patient by not performing due diligence in intraoperative assessment, which could lead to surgical errors. Another incorrect approach is to proceed with the reconstruction based on a general approximation of the landmark's location, particularly under perceived time pressure from an efficiency study. This disregards the fundamental principle of precise anatomical dissection and placement, violating ethical obligations to provide the highest standard of care and potentially contravening guidelines that emphasize meticulous surgical technique. A third incorrect approach might involve delegating the critical landmark identification to a less experienced team member without direct, vigilant supervision by the attending surgeon. This could be seen as a failure in direct patient management and supervision, a core responsibility of the operating surgeon, and could lead to errors that compromise patient safety and surgical outcomes, thus failing to meet the expected professional standards. Professional reasoning. Professionals should approach this situation by prioritizing patient safety and anatomical accuracy above all else. The decision-making process should involve 1. Recalling and applying detailed craniofacial anatomy knowledge. 2. Performing meticulous intraoperative palpation and visual inspection of the supraorbital rim and zygomatic arch. 3. Cross-referencing findings with preoperative imaging, but not relying on it exclusively. 4. Communicating clearly with the surgical team regarding identified landmarks. 5. If any ambiguity exists, taking the necessary time to resolve it before proceeding, even if it impacts perceived efficiency. This systematic and cautious approach ensures that the surgical plan is executed with the highest degree of precision and safety, upholding the ethical and professional standards of plastic surgery.